Introducing the revolutionary TAP PAP nasal pillow mask. The TAP PAP utilizes a thermocryl mouthpiece that molds perfectly to your upper teeth and a pair of nasal pillows which fit comfortably to the nares using the adjustment joint at the base of the mask frame. The inlet tube is routed over the head and connected to the CPAP tubing. Many patients will use their TAP PAP without headgear since the mask is anchored securely to the upper teeth. This results in improved comfort without leaving annoying marks on your face in the morning. When correctly fit, your TAP PAP will not leak. This is due to the stable positioning of the mask while anchored to the upper teeth. As you can see, the TAP PAP is very stable regardless of the position in which you sleep. TAP PAP is so secure that it is not necessary to tighten the mask against your nose to maintain a seal. The result is maximum comfort. Unlike most nasal pillows masks, it is very easy to breathe on the TAP PAP at any pressure setting. The work of breathing is reduced because of the streamlined design of the mask. The TAP PAP nasal pillow mask uses a larger bore inlet tube while eliminating the elbow connection, which is present on most other mask designs. TAP PAP is also extremely quiet. Independent testing shows that the TAP PAP is one of the quietest of all nasal pillow masks. Finally, there is a mask that enables you and your partner to sleep through the night. The TAP PAP nasal pillow mask from Airway Management. Now, a few warnings before we begin. You must have at least 8 original upper teeth in place. You can't have any broken or loose teeth and fillings, no periodontal disease, no removable dentures, no orthodontic appliances. You must have seen a dentist within the last year, and please read the instructions before use. Now first loosen the nut and remove the mouthpiece. Put the nut and bolt in a safe place. Place the mouthpiece in your mouth and bite down gently. You should find that your upper teeth fit within the flat surface of the mouthpiece. If not, you will need to widen or narrow the mouthpiece after heating. Now, prepare water for boiling. You can do this several different ways. Carefully pour boiled water into a large bowl. Submerge the entire mouthpiece in hot water for 60 seconds. Using a set of tongs, carefully remove the mouthpiece from the hot water and vigorously shake off the excess water. Then let the mouthpiece sit for 20 seconds. If you need to widen or narrow the tray, use your thumbs to separate as shown. Place the mouthpiece in your mouth for fitting. Apply pressure pushing up against your teeth and back by using the clear post of the mouthpiece for leverage. Suck on the mouthpiece and push with your tongue towards the roof of your mouth to help seat the mouthpiece to the inside of your teeth. Check the alignment so that the clear post is directly beneath your nose. You can do this by placing your hands on each side of your nose or by looking into a mirror. Make sure the mouthpiece is centered. Bite down gently while continuing to suck on the mouthpiece and pushing with the tongue to the roof of your mouth. Leave the mouthpiece in your mouth for 2 minutes with your mouth closed. Then, open your mouth and breathe through your mouth for an additional 2 minutes, allowing your mouthpiece to cool. Remove the mouthpiece by hooking your fingers over the top edge of each side of your mouth. Practice taking the mouthpiece on and off a few times. You should have a firm but comfortable fit. Now, if your mouthpiece is too tight, you may try firmly spreading your mouthpiece with your fingers while the mouthpiece is cold, or hold it under hot water for 15 seconds and then reinsert. If your mouthpiece is too loose, too tight, or at an incorrect angle, you can repeat the fitting process. The mouthpiece will return to its original shape when placed in boiling water, and the fitting process will need to be repeated. Before reattaching the mouthpiece, check the size of the nasal pillow seals to your nares by holding the mask up against your nose. Ensure that the outlets fit into your nares and that the outer rim of the seal extends beyond your nares. Your mask comes pre-assembled with size medium nasal pillows. The nasal pillows are interchangeable. Small and large sizes are included in the package for you to achieve the best fit. To change the size, remove nasal pillows by pulling the seals out of the mask frame. If in doubt about sizing, use large nasal pillows. To reinsert the appropriate size, pick up each pillow individually and squeeze at the base using your thumb and middle finger. Place one side of each pillow into the groove and then use your index finger to guide the other side into the groove. Push firmly down on the seal and turn the mask over and view from the bottom side to make sure the seal is inserted evenly around the ridge. Lastly, rotate the seals so that they are aligned with each other in a parallel fashion. Reassemble the mouthpiece as shown. Orient the nut to the appropriate side depending on whether you are left or right-handed. Now don't fully tighten the nut just yet. Reinsert the mouthpiece on your upper teeth and adjust the mask and pillows to your nose. When you achieve proper placement, tighten the nut. This may be worth doing in front of a mirror and should not be tight against your nose. Attach the CPAP tubing to the swivel connector and turn on the machine. Feel around the pillows for any leak and adjust as necessary by loosening the nut and moving the mask. If you have an air leak, recheck the size of your seal and change sizes as needed. Make sure that the mouthpiece is centrally located to your nose. If it is not, you will need to repeat the mouthpiece fitting process. Lie down and turn your head from side to side, ensuring that the mask remains in place without an air leak. Please note that exhaled air will escape out of the front of the mask via the tiny holes in the frame. This is normal. When waking up, you may now remove your mask as is in one piece. Do not loosen the nut. If you have a snug fit between your nose and mouth, you may need to loosen the nut upon application of the mask. When you're ready to go to sleep, hold the mask upright and place the mouthpiece in your mouth and the nasal pillow seals to your nose. Then connect the CPAP tubing to the top of your mask hose. Turn on the CPAP, check for leaks, and lie down for a peaceful night's sleep. The TAP PAP nasal pillow mask is so stable that it will not leak regardless of your sleeping position or with movement during the night. CPAP users sleep more soundly with the new TAP PAP. This is due to its overall stability and lack of air leak, which eliminates the need to wake up during the night and adjust the mask. Cleaning your TAP PAP nasal pillow mask is easy. Under normal conditions, it is recommended that after each use, rinse the mouthpiece with cold water. Do not use hot water in any part of the cleaning process, as this could alter the fit of the mouthpiece. Wipe off the pillows of any residue with a damp cloth. Now, on a weekly basis, fill your sink with lukewarm water that contains a mild, non-scented soap such as ivory liquid. Rinse all components, including the mouthpiece, nasal pillow seals, mask frame, headgear, and chin strap, if used, for no longer than 10 minutes. Refrain from using any soap that contains moisturizers, antibacterial, antiseptic, alcohol, bleach, or chlorine agents. Thoroughly rinse with cold water to remove all soap residues, and then place the components on a towel to air dry out of direct sunlight. Before use, reassemble the mask. Always check for any damaged components that may need to be replaced for proper function. Check that the vent holes are clear and free of any obstruction.